Right now, Missouri faces a startling backlog. People deemed mentally incompetent to stand trial are waiting 14 months on average for required treatment. And as of this month, 489 Missouri defendants were waiting, many of them waiting from a cell. The Marshall Project is a nonpartisan, nonprofit news organization covering the criminal justice system. Jesse Bogan is the reporter that broke this story. You've been working on this, Jesse, since June. Thank you for coming today and helping us break this down, because there's a lot of nuances. It's a complicated story, but the crux of it is, when people are deemed incompetent to stand trial, you have to be able to aid in your own defense. You are required to get help and go to a facility to hopefully be able to restore your competency so then you can go and be on trial. According to your reporting, about 80% of defendants are able to restore competency. The problem you're focused on is the line to get that therapy, to go to the facility, is getting longer and longer. Why is it getting longer?
Well, for years there's been this increasing wave of people coming into the criminal justice system with severe mental illness, and if you can't aid in your own defense, you can't be prosecuted, you can't assist in your own defense. And so there's a system in place to flag people who need to be evaluated to find out if they're incompetent, and if they are, then they get in line, and it's 14 months to get to a treatment bed, typically at a state hospital.
And that line, that 14 months, it was shorter even last year and the year before. So why is it getting longer? Why is it because they don't have enough staff, they don't have enough facilities, or it's just there's more patients who need the help?
Complex problem for sure. There's a lot of turnover at the Missouri Department of Mental Health. About 60% of people leave the job who are in direct care at the Missouri Department of Mental Health. That's a problem. There are so many people who need the help, and so obviously, and there's a limited amount of bed space, and so that's part of the reason why it goes, it's longer and longer. And so 2 years ago it was an 8-month wait, and now it's 14 months. There were 250 people in this position 2 years ago, and now there's about 500.
So double to 2 years ago. So most of these people are waiting where, and for the most part, are they getting any mental health help there at all?
Right. Most of them are waiting in jails, and that's a problem. And it's pretty amazing to hear sheriffs, jail administrators, I mean, they're very fed up over this. This is not a new problem. It's just built and built and built. And so in Jefferson City, you'll hear people talking about this at the committee level, that there need to be some better solutions. The state of Missouri did respond. You know, a couple years ago, a law passed so you could do more treatment in the community. That's been slow to take off. They responded by allowing treatment to start in some jails, like here in St. Louis City, the county, Kansas City, Jackson County, Clay County. Greene County said, eventually said, no thanks, we're not going to warehouse people that shouldn't be in jail. Now there's remote jails where this is happening too, where there aren't as many medical resources. And so there's supposed to be a mobile unit where they go and reach people who are stuck in remote jails. Now the purpose of this story that we ended up doing was to look and see how those programs are doing. And it's clearly the reporting signals that it's not doing enough.
Has it put a dent in it? Because you just talked about a couple ways the State Department of Mental Health, the Missouri Department of Mental Health, has tried to do something.
Yes.
But overall, it doesn't seem like it's done much. It's done a little bit. Is that fair?
I don't know how to quantify that other than to say, you know, in St. Louis County, in the program they were doing in the jail there, 16 people basically in the last year were in that program, and 2 people completed it. A lot of people who are deemed incompetent to stand trial are really sick and they need help. Some of them don't even qualify for the program. They don't know where they are, they don't know what they're doing, they do not progress, okay?
Right.
And so that's the criticism that I heard from jailers, jail administrators, was that this mobile unit is not very mobile. It's, they're working, you know, they're doing electronic media and stuff like that. And a lot of the people in this situation do not want to leave their cells, and so that's not good. That's something that's notable. These are people who really don't thrive in jail, and that's where they're stuck, and for longer periods of time. And so they're deteriorating. The job is harder the longer they stay in jail.
Jesse, thank you for being here. Of course, you can read Jesse's full article with the Marshall Project on our website, ksdk.com. Brent?